Hello, good morning. Our today's session is on Materia Medica, and this Materia Medica we will be covering four important drugs which acronymed CGHS are among the remedies of day-to-day use with full miasmatic potential, especially the anti-psoric effects. So now we will talk about Causticum, about Graphites, Hepar Sulph, and Silicea. These are the drugs which have been proved by Hahnemann, basically which have been described under chronic diseases as anti-psoric remedies. It is not possible for a small session to have complete discussion of even a single remedy from among these. But we shall try to cover all these four remedies, their salient features, and we'll try to make them more familiar to you and simpler to use. Because it is said that forgetting is the key to memory. Sometimes we know too much of Materia Medica, and when we know too much of Materia Medica, and when we start to know too many of the remedies, the result is that we neither know any of them in details nor are able to have confidence in their use. So it is said that it is always good to have few friends but more dependable friends. So first of all, it is important for us to select the remedies about which we want to know well, and naturally what I said, forgetting will automatically become key to memory. So we first go to Causticum. Now Causticum remedy, and for that matter the protocol which we are following, is that we shall be taking some salient features from Allen's introduction, Allen's keynotes. I must tell here that Allen's keynotes, which you already know, is a book which he wrote as professor of Materia Medica for the help of his students, and the Allen's keynotes doesn't contain a single sentence of his own. That is, it is only a compilation, and the compilation is from Hering's guiding symptoms. The double bold and the bold symptoms and the features from Hering, he took up and highlighted them, and that is why it is applicable for a good keynotes. And in Calcutta, initially it was followed very rigorously. Now not only in Calcutta but in other places also we find the use of Allen's keynotes. So we'll take introduction from Allen's keynotes. Adapted to persons subject to affections of respiratory and urinary tract. So that is the upper as well as lower respiratory tract and the urinary tract. Then use in children who are delicate, sensitive, their skin is prone to intertrigo, that is frictional erythema, redness, or called napkin rash, that is allergy we may call it, and during dentition, that is another pointer, or convulsions with eruptions of teeth, that is dentition. Then disturbed functional activity of brain and spinal cord. More than structural, it is the functional activity from exhausting disease or severe mental shock resulting in paralysis. Then we go to mind. Now remember here that the mind symptoms we have collected are very cautious, with anxiety and fears that something will happen. Now this is collected from Vermeulen, and that is the salient features. Vermeulen is nothing but a boric Materia Medica, like a boric Materia Medica. The only thing is that it is after over 100 years. Boric was written in 1921, whereas this Materia Medica is written in 21st century or the end of that century. May not be 100 years, maybe 75 years or something like that. So it is an advanced insofar as the time frame is concerned. The current words and the current nosology and the names are found here. So anxiety of all types, worse in evening, when shadows grow taller, and fear of darkness. Thinks about and avoid what would happen. Full of care, extreme care. And this, did I lock, did I put off the lights or not, goes and checks it and again confirms it. So this is a feature of OCD, that is anxiety. Constantly feels, has forgotten something. So that is the characteristic feature. Then melancholy, sadness with weeping. Now we go to Hering's repeatedly verified symptoms, that is double bold symptoms. We have taken out from mind of Hering's guiding symptoms the double bold symptoms. So these are enlisted number wise. Melancholy from care, grief and sorrow. This melancholy is representative of depression. Melancholy mood, sadness, hopelessness, mental and other ailments from long-lasting grief and sorrow. Peevish, irritable, censorious mood. Then the least thing makes the child cry. That is, smallest thing, even the idea of pain will make the child cry. Now, these symptoms have been decorated in an ornamental manner, covering some Freudian concepts and this and that, and accordingly each of the symptom has been taken to a conclusive end, but sometimes causing much of confusion. So let us only give its only importance to it insofar as the psychiatry is concerned, that it represents a very sensitive child. Then we go to causation. Here the ailments are there from long-lasting grief and sorrow. So that is stress. And phosphoric acid is another remedy which covers the long-lasting grief and sorrow. Then loss of sleep, night watching. Night watching, there are other drugs, cocculus, cuprum, ignitia, nitric acid, etc. Sudden emotions, fear, fright, joy, anger and vexation, and suppressed eruptions. Then paralysis. This remedy has got a lot of paralytic symptoms. Single parts, vocal organs, tongue, esophagus. You'll know all these. Eyelids, face, extremities, bladder, right side, then right side hemiplegia. Then ailments from exposure to wind, draft. After typhoid, typhus, you may say any exhausting long-lasting diseases, diphtheria, and gradual onset is the characteristic. In generalities, we see rheumatic affections, then contraction of flexor muscles and tendons, tension and shortening of muscles, then must move constantly, but motion doesn't relieve. Menses is too early, too feeble, and only during the day, which ceases on lying down. Peculiars are rawness or soreness is a characteristic word we associate with Causticum. Scalp, throat, respiratory tract, rectum, anus, urethra, vagina, uterus. Involuntary urine while coughing. Cough with pain in hips, that is distant parts, relieved by cold water. Then hoarseness in the morning. Drooping of upper eyelids called ptosis. Then constipation, stool passes better when standing with piles. Then we have skin symptoms. There are warts, large jagged warts, pedunculated warts which bleed easily, exuding moisture, small all over body, on eyes, face and nose. Remember, warts on the face are especially psoric warts. Cicatrices, especially burns which freshen up, injuries open up and never well since that particular burn. Warts rubrics on radar we find in the double bold symptoms are rather bleeding warts, then causticum and thuja, extremities upper lid, calcarea and sepia, extremities hand, baryta-carp, calcarea, causticum, nitric acid, sulfur and thuja. You can see it yourself in radar. Extremities, fingers, leg caninum, then face, causticum, horny warts and Tim crude. Then jagged warts, causticum, nitric acid, thuja, large warts, nitric acid, thuja, pedunculated, causticum and nitric acid, smooth warts and Tim crude, and soft warts, nitric acid. Modalities are aggravation in clear fine weather, that is very characteristic. Worse by cold air, especially on becoming cold from getting wet or bathing. Then ailments in damp, wet weather from warm air. Patient is better. Now let us put a small summary that right-sided melancholic or sympathetic patient with warts, cicatrices, hemorrhoids, uterine prolapse, delayed milestones, etc. Then with raw, sore or paretic part, characteristic laryngotracheobronchitis, fondness of cloudy days, ailments from burns, emotions, and finally sora, that is chilly, anxiously cautious, scabies, restless, sleep, etc. So that covers our causticum picture. So next drug is Graphites. Now in Graphites, Allen's introduction tells suited to women who are inclined to obesity, who suffer from habitual constipation with a history of delayed menstruation. What pulsatilla is at puberty, Graphites is at climacteric. That is, as we commonly prescribe pulsatilla for puberty ailments, for climacteric ailments, Graphites as well as lachesis also is to be remembered here. Excessive cautiousness, we saw that in causticum also, timid, hesitate, unable to decide about anything. So this indecisiveness is at the root of anxiety, because behind anxiety there is always a conflict, and conflict means inability to decide. So we have to psychiatrically analyze that. Then these are very cautious, timid, hesitating persons who are unable to decide mentally. These features have been enlisted here again. Fidgety at work, sad and despondent, music makes her weep and thinks of only death, that is depression. Now double bold symptoms, fidgety when sitting at work has been taken from there, you can see. Apprehensiveness with inclination to weep, infrequent attacks. Now importance of these double bold symptoms of hearings must be remembered, because whatever interpretation Materia Medica mind you make, you must see that it matches with the basic proved symptoms, because these are the symptoms which have been proved, which have been reproved, and which have been confirmed by cures. So that is the basic, and from that basic, if the description is not matching, then you give more importance to the basics. Then feels miserable, unhappy, sad and despondent. She must weep, music makes her weep, sadness with thoughts of nothing but death. Then we go to the skin of this particular remedy. Cicatrices after mammary abscesses, retarding flow of milk, cancer of breast from old scars and repeated abscesses, unhealthy skin, every little injury suppurates. So you can see that this can be a good remedy for diabetes, provided the picture matches. Old cicatrices break open, burns we saw in the last remedy, eruptions upon ears, between toes, various parts of body, then oozing, watery, transparent, sticky fluid, then cracks and fissures, where at the end of fingers, nipples, labial commissures, that is junctions, around anus, between the toes. Then nails. Nails are appendages of skin. So brittle nails, crumbling nails and deformed nails. Painful, sore, as if ulcerated, and thick and crippled nails. Sometimes some very simplified generalization has been made that all the nail disorders are psychotic. That is not true. It is too wholesale a method of describing that. We know that these are soric also because they are appendages of skin. Too scanty menses, pale menses, late with violent colic, dysmenorrhea is there, irregular menses, delayed from getting feet wet, then morning sickness, during menses, then very weak and prostrated. So that is about menses. Then leukorrhea, acrid and excoriating, then gushing day and night before and after menses. Then constipation, chronic, difficult, large hard stools, knotty with lumps united by mucus threads, too large, then smarting, sore pain in anus after stool. Other features are decided aversion to coition. This aversion to coition, remember, is a feature of depression, whereas the opposite of it, excessive desire, is a feature of hypomania or mania. Sexual debility from sexual abuse, cataleptic condition without power to move or speak, children impudent, that is, they make, they're unwise, they're torturing, they're teasing, they laugh at reprimands. Then burning, round spot on vertex, sensation of cobwebs, makdi ka jala, as if a cobweb is there on the forehead. It tries to remove it again and again, but hardly there is anything, tries hard to brush it off. So that is paresthesia. Hears better in a noise, then riding in carriage when there is rumbling sound, then takes cold easily, work by draught of air, suffering part emaciate. Main indications are paralytic weakness and relaxation of tissues, discharges are acrid, offensive and scanty, except leukorrhea, which is profuse. Then cracks and fissures, especially in folds of skin around the joints and about the orifices, the eyelids and canthi, that is the corners, nares or nares they call it, corners of mouth, then fingertips, nares are the nostrils, between the toes, then eruptions, eczematous, moist, crusty, discharging, sticky fluid, itching, herpes, pimples, erysipelas and veins, then rawness in the bends of joints and folds of the skin behind the ears. Nails are thick, deformed, they are black, the hair are dry and falling, then cicatrices, then indurations, hardnesses, calluses, that is the horny tissue. Small wounds suppurate and are slow to heal, obesity and emaciation. Then finally the modalities: worse in the morning, evening, night, open air, then cold, pain in limbs, coryza, stomach symptoms are like that, worse by open air and cold draft, then warmth of bed, warm room, and better by warmth, pain in limbs, coryza, stomach, after eating and lying down. That is a very characteristic, generalized or general modality, that patient is better by eating and patient is better by lying down. So that completes our description of graphite. Importance of Hepar Sulph is paramount because Hahnemann has in chronic diseases asked us to repeat Hepar Sulph from time to time as an antisoric, and it stands at almost an equal height to sulfur of course, after that. So we have to understand the picture of Hepar Sulph. Now, Hepar Sulph, Allen's introduction is slightest injury causes suppuration. Diseases where system injured by abuse of mercury. Now mercury is not there, but then any injurious agent, it could be for that matter steroids also, where we find its utility. So where the system has been injured by abuse of drugs, oversensitive physically and mentally, slightest cause irritates him, highly irritable person. Then quick, hasty speech and hasty drinking is the characteristic. Then summary features are touchiness and hypersensitiveness, mental as well as physical. Hypersensitiveness to touch, pain and cold air. Unhealthy skin festers instead of healing. Easy suppuration, so it has got its own role in diabetes. Then sticking pains as if fish bone or splinter in throat, where we compare this with argentum nitricum, calicarb, nitric acid and Silicea. Then we see the mind from Vermeulen, extreme irritability, angry and abusive patients, impulsive, sudden impulse to stab his friend, like in barber, sudden impulse to cut throat of his patron. Then in mother, impulse to throw child into fire or to set herself to fire, injure herself or injure child. Impulse to do violence and to destroy, and mania to set fire to things. Hering's double bold symptoms, let us see. Great weakness of memory with irritability, violent, fretful, passionate, spoke with great volubility, volatileness, would not listen to any remark offered that shows the anger, the temper, malicious mood, injurious, harmful, feels as if he would murder someone with pleasure. So this is the basic symptom which has been noted by proving, reproving and confirmed on cures. Child does not incline to play or to amuse itself in any way, does not laugh. That is, normally the children are playful, cheerful, but here it is not so. Depressed and irritable mood, sad mood for hours together, must cry violently, low spirited, even to thoughts of suicide. Then impelled by unaccountable attacks of internal anguish, which sometimes come on quite suddenly, to attempt suicide. The slightest cause irritates him and makes him extremely vehement, angry. Then temper obstinate and cause a ferocious spleen. Ferocious spleen is the word which is used in literature for desire to harm or kill oneself, which would lead to cold-blooded murder or even to others, even among those habitually gay and benevolent. So that is ferocious anger. Wrathful irritability, heightened irritability, even to most extreme violence, threatening to end in murder and arson. Then peevish, angry at little trifles. So this shows us about the mentality. Then psychiatric analysis we can make that here we have listed desire to murder and arson, symptom numbers 3, 9 and 10. Then desire for suicide, symptoms number 6 and 7, and depression, symptoms 4, 5 and 6, and extreme irritability, that is 1, 2, 8, 10 and 11. Let us analyze them one by one. The desire to murder and arson, here malicious mood, feels as if he would murder someone with pleasure. Then temper, obstinate and cause a ferocious spleen, that's what I have already read. Then wrathful irritability. On the basis of these three symptoms, number 3, 9 and 10, we can conclude that the patient has got desire to murder and arson. Then number 6 and 7 symptom is sad mood for hours. Then impelled by unaccountable attacks of internal anguish. There is sudden attempt to commit suicide. So these two symptoms prove that there is desire to suicide. Then the depression is concluded on the basis of symptom 4, 5 and 6. That is, child does not incline to play or amuse and does not laugh, then depressed, irritable mood, sad mood for hours, low spirited. So on the basis of this, the third conclusion is drawn about depression, and the fourth conclusion, extreme irritability, is based on symptom number 1, 2, 8, 10 and 11, which you can read it: great weakness, then violent, fearful, passionate, then slightest cause irritates him, then wrathful, irritability, peevish, angry at least trifles. So in this way, this psychiatric analysis can be made. Now, skin glands and bones, phalanx, that is vitello around root of nails, then glands of neck, axilla, groin and mammary swell, they become hard and suppurate, bone suppurate, necrosis and caries is there. Then Bonninghausen's Kraut powders are to be remembered. 5 powders Bonninghausen used for cold and Kraut, that is the upper respiratory trouble, and first was aconite, second was spongia, third was Hepar Sulph, fourth was again spongia, and fifth was Hepar Sulph, needing as many as required. That is, if in 1 it became alright, then second was not used, and if in 2 it became alright, third was not used, and as many as 5 were dispensed for this purpose. So that is Hepar Sulph. Now the fourth drug today is Silicea. Silicea, as the mind, first gentle and tearful women, but Silicea, child is cross and cried when spoken to. Lack of grit, the patient lacks stamina and confidence. State of embarrassment, dread, fear, a state of yielding. When professionals lack self-confidence, firmness, fullness of thought and speech, dread of failure, often imaginary, loss of self-confidence in students and professionals, then brain fag of professional man, student, lawyers and clergymen. Hearing's double-bold symptoms, let us see from where all this is derived. Child becomes obstinate, headstrong, cries when kindly spoken to. Compunction of conscience, that is pangs of conscience about trifles, over conscientiousness. Confusion of mind, difficulty in fixing the attention. Desponding, melancholy, tired of life, gloomy, feels as if she would die. Mental labor is very difficult and over anxious about himself, low-spirited, weeps every evening. Then reading and writing fatigue, cannot bear to think. Restless, fidgety, starts at least noise. Very irritable, low-spirited, peevish mood. Very sensitive, weeping mood. Wishes to drown herself, then yielding, faint-hearted, anxious mood. Now this is Hearing's guiding symptoms, double-bold symptoms. Add your knowledge of psychiatry of the time and get the picture. Now heat and cold reactions are: Silicea is a chilly patient. Symptoms develop in cold, damp weather, often better in cold, dry weather. Symptoms come out after a bath. Avoids cold air, must have head wrapped up, especially painful parts which perspire copiously. Sweat about upper parts of body and head. Then disturbed by extremes of heat and cold. Here it is comparable with muscle. Easily affected in changes even of a few degrees. Then headache, chronic sick headache commencing from back of head, better from heat and attended with profuse head sweat. This headache worse by cold air, from cold air once a week, that is periodical. Worse from mental exertion, excessive study, noise, motion, even jarring from footsteps, light, stooping, pressing at stool, talking, cold air, touch, etc. A picture of migraine. Then glands and bones, especially with ear troubles, indurated parotid glands, Pulsatilla has got acute inflammation of parotid, whereas Silicea has chronic forms due to sora, scrofulous glands. Hardened glands about neck, cervical, salivary, especially the parotid glands, enlarged from every cold. Then affections of cartilage, growths about the joints, about the fingers and toes, caries, small bones of ear, then nose and mastoid process, then syphilitic nasal catars parts are phagedenic, that is degenerate. Hepar, Merck and Rs are principal antisyphilitics when there is phagedenic ulceration of nose. Then eyes are inflamed, traumatic cause. Then foreign particles, angular conjunctivitis, tarsal tumors, then fistula lacrimalis, where there is watering from eye due to lacrimal fistula, stricture of lacrimal duct in small infants. Then desires and aversions, aversion to warm food, unhappy to drink hot fluids, cause sweat about face and head, hot flushes because they like cold food, aversion to milk, desires cold things, even tea is taken moderately cold. Then likes ice cream, ice water, comfortable when it is cold stomach. Face is silky, anemic, waxy and tired looking. Then inflammation of periosteum, that is periostitis. Then corns, ingrowing toenails were comparable with entim crude and graphites, which you have seen. Rheumatism of soles of feet, cannot walk, entim crude, medorinum ruta and Silicea Allen mentions as a comparable. Then begins to sweat as soon as falls asleep. This is a symptom found in conium also. Complaints from suppression of foot sweat, otorrhea or fistulous discharge. Then finally the relationship is that of trio, complementary to calcarea, pulse and thuja. Then there are four trios. One is pulsatilla, Silicea and fluoric acid. Second is sulfur, calcarea, lyco, very well known. That doesn't mean you blindly give one remedy after another. You be in look for the symptoms and be in search. Most probably they will follow. Then colocynth, causticum and staphysa agria is a trio, especially in joint pains and rheumatic troubles. Then sulfur, sarsaparilla and sepia. This also is a trio which could be applicable to urinary complaints. So that completes our today's part 1, and thank you for hearing patiently. So this part 1 is over.